I was really interested in bringing people together today to start to look at some of those changes that are taking place in terms of the transformation of the NHS, and particularly to get people to think about it, how it affects them professionally and personally. Because I think a lot of what's going on here is about understanding what's driving different partners, what's motivating them, and it's better to understand that so you can speak to people in the same language.
The three main changes for the local authority is that it transfers responsibility for public health from the NHS to local authorities. So local authorities become responsible for health improvement across the whole of their population. We also become responsible for setting up the health and wellbeing boards, which bring together both NHS and social care and public health commissioners, so we are responsible for trying to shape services across the whole system. The key partners locally are the clinical commissioning groups, which is the GPs and their partners, who will be making a lot of the decisions around how health is commissioned and designed within the area.
What clinical commissioning means is actually putting GPs at the forefront of decision making in the healthcare system. So we are a group of 8 GPs from all around the Huddersfield area who are now sitting on the board, and we're making decisions on behalf of the whole of Greater Huddersfield, which is 238,000 patients. We have a very strong desire to work with the patients and the public. We want their voice to be heard, not only in the GP surgeries, but also when we have to make big clinical decisions that affect the whole of Huddersfield.
The reforms in the NHS are actually really wide-ranging for public health. Essentially, they mean, in some cases, a return to our roots, in that most of the public health staff will be going back into local councils, which is where actually local government started in the 19th century. You know, we set up local councils because we needed to sort out sanitation and infectious diseases, cholera and so on, and of course, you know, public health staff are involved with those things. So to a certain extent, just going back to our roots, housing, planning, licensing, all those kinds of things that we'll be involved with again. But also some of us will be moving into new organisations that don't exist yet, like Public Health England, for example, and so there will be some fragmentation of the service. Having said that, it does mean there'll be public health involvement across the system. I think one of the key relationships is with the new clinical commissioning groups, but we've been forging those relationships over the last year, and each of the 2 in Huddersfield has a public health consultant on their board, so that we're able to advise them on public health matters.
Healthy living pharmacies are not all pharmacies. At the moment in the Kirklees area we have 7 pharmacies that are accredited, and it's a bit like investors in people, that the pharmacies have to attain a certain standard of services and training to be a healthy living pharmacy. So the leader has to have done leadership training, which is usually the pharmacist, and also we have health champions that tend to be the counter staff and the dispensers that have had some extra training on delivering health and wellbeing advice. Also, the premises have to be to a certain standard, and there has to be a consultation room so you can have a private consultation, and there's got to be information that's of a certain standard. Finally, they have to offer a range of services, for example, helping you to stop smoking, sexual health advice, advice on other health and wellbeing issues. So that range of services have to be provided. Then you have to put in and apply for accreditation, and the pharmacy finally gets a kite mark and a recognised trademark that will be in the windows and in the literature of the pharmacy. As I say, there's 7 at the moment in Kirklees, 5 more coming in July, and many more through the case of the rest of this year.
The short-term challenge is the transition into the new system, and I think we're all very aware there's some really exciting opportunities in all the changes, but we need to make sure we don't lose a lot of the existing work and things don't fall through the crack. So there's a big challenge for us just developing those new relationships and making sure we can keep things on track. For me, one of the big challenges, and it's an aspiration of the new legislation, is how do we better join up health and social care. And many people who receive both will say that for all the good work that we do, there is still sometimes difficulty understanding when is it health, when is it social care. Sometimes we'll still see too many people, sometimes have to tell their story too many times. So how we really join that up and get that right. And I think within that we also have the big challenge about how do we better provide preventative services. So how do we support people better at home? How do we support people, as Steve mentioned in his presentation, on pain management, on managing long-term conditions? How do we prevent hospital readmissions? How do we support people when they come out of hospital? So how we actually design the whole health and social care system around every individual who needs that service.
The event today, I think, gave us an opportunity, and I brought some of the members that we work with, that's adults with Asperger's syndrome, to fill them in really about the idea of what changes are going to occur. Because quite often people with autism or Asperger's can find it difficult to process change. I think it's great that HealthWatch seems to be having this idea of involving, you know, patients and end users and service users as much as possible. And what we've been trying to be doing over the past year through the Kirklees Autism Strategy Group is to involve people with autism as much as possible in decisions that are going to affect their day-to-day lives.
Well, I work for Kirklees Council in enterprise and social enterprise development role. I'm very interested in how communities are able to take advantage of the opportunities that some of the changes in the NHS might mean. So I was interested to get a better understanding of HealthWatch and also some of the big policy changes that are affecting the NHS. The role for the community and social enterprise sector in providing services, I think, is that they are much better able to have reaches into communities that can sometimes be quite difficult to engage, particularly for large organisations and certainly within a lot of large health organisations. I think there's lots of groups of people in communities who would respond much more positively to a social enterprise or a community organisation, and it's about making the most of the opportunities for those organisations to tap into the resources that they need to continue their work. I've learned much more about the wider policy context and how that fits and how HealthWatch fits in with that. I think it was interesting to hear some of the comments from the other delegates around how their concerns about communities, you know, making sure that they're involved and that they have their say. So it was really interesting to hear from that. And the big thing that I've learned is about the community pharmacies. That was something that I wasn't aware of, and I think that would have a really good link with some of the work that I'm involved in.
I came along to this event today because I've just started a new social enterprise jigsaw enterprise training which delivers personal development opportunities to people, and I just wanted to see how the things I deliver, such as confidence building, managing emotions and assertiveness, might be able to complement traditional health services. Because I am a direct receiver of social care, it's really helped me understand what I should be having and what I'm entitled to, so I can challenge in an informed way.
Well, I work in the health service and I'm extremely interested in all the changes and reforms that are now going to be taking place. So much so that I've actually been actively involved in campaigning against the Health and Social Care Bill. What I would say in terms of learning from today is not that I've personally picked up things, but I think that the audience was very, very good in terms of number and quality. There's a lot of good questions from people out there, and I think that itself illustrates that from these questions, not all the answers have already been defined. So hopefully, working together with the users, the service users, the community, as well as the providers, cooperatively, not in opposition, will bring about the best in quality in the services that are provided. That's my essential hope.
Well, I would hope that we can structure HealthWatch in such a way that that becomes a very visible and very involving network for people. It will also be able to take on responsibility for individual advocacy. So I hope what people see is one kind of clearer front door for how they get involved in how services are shaped, how providers are working, as well as being able to pick up any individual issues. I would say that HealthWatch will be supported by a range of other mechanisms. I think I touched in my presentation on the fact that foundation trusts have member networks and public involvement. Local authority has a whole range of mechanisms for involving communities and service users. So what we want to do is make sure that HealthWatch works well with all the existing mechanisms as well. But what I would mainly say, I think, is anyone who wants to get involved, please contact us and we will find a way for people to get involved. And if you think the mechanisms aren't working, say so, and we will look to improve them.